Tips and tricks for counsellors and in everyday life. Exercise. How do we use it in the counselling room? And how can we best use it effectively in our own lives? Well, the Australian standards talk about 2.5 hours of exercise a week across most days of moderate intensity. Nothing wrong with that. A good headline statement. But the literature is changing quickly. And the literature is now in a place that it can actually advise us in an evidence-based way to say what sort of exercise particular clients might respond to. So, for example, anxiety, autism spectrum disorder, and bipolar disorder. The literature would suggest at the moment that while exercise might have great social benefits, there's no specific mechanism that provides a therapeutic benefit. No biological mechanism that links exercise to the treatment of these disorders. But what about ADHD? There is evidence to show that ADHD responds to exercise. It's Pilates. Go figure. I would have never imagined. But it's not just that Pilates seems to be effective with inhibitory control, but it's developing a routine for exercise, doing exercise over the long term that matters. Or what about schizophrenia? With schizophrenia, it seems to be that yoga is important, as is resistance training and aerobic exercise. And finally, the one we're most familiar with is depression. Depression and exercise, we know they're important. We know that we have to get people to move and to exercise and to breathe deeply if they want to feel better about themselves. We also know that this is a very hard thing to do. But what exercise is actually suggested for depression? Well, it's not the exercise that matters so much here, but the intensity. The greater the intensity, the more beneficial the outcome. But if you did have to choose an exercise to use with a client who has depression, you might want to think yoga, you might want to think strength training, or jogging. These seem to be the ones that show a really good positive outcome. But with everything, make sure you work within your scope of practice, and make sure, for goodness sake, that you get your clients to have a medical clearance before they start exercising. That's only sensible. And finally, and yes, pun intended, have them walk before they can run. There's nothing worse than a client who tries to exercise for the first time and just hurts so much that they remember how awful PE was at school and they say, nope, I'm not doing any more exercise. Start off gently, make it a positive experience for your clients. Choose the right sort of exercise and the right sort of intensity for who they are and what they're presenting with, and I'm sure counselling will go wonderfully well.